Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-year cancer survivor, available on Amazon. Continuing on with my series on cancer survivorship care, we're going to move into the field of gastroenterology. And basically, that's going to cover everything from mouth to butt. So, your mouth, your esophagus, the stomach, your lower intestine, your large and small intestines, and of course your rectum area. Your digestive system basically goes through four stages. You have ingestion, which is eating. You have digestion. You have absorption, where all the nutrients that your body needs, whatever, gets absorbed into your body. And then, of course, elimination, whether it's pooping or peeing. Normal complications of your GI system include reflux, also known as GERD, irritable bowel syndrome, celiac disease, Crohn's, colitis. There are numerous tests that you can go through to determine if you're having gastro issues, from scopes, barium swallows, scans, things like that. When it comes to cancer, you have short and long term side effects. Now, I want to be clear, I'm not a doctor, okay? I am speaking basically from my own experiences and knowledge that I have. The effects of chemotherapy and radiation can be really harsh. Not everybody gets them. Not everybody gets each one. Some may only get a few, some may even not get any. But as far as the short term side effects, you know them when you get them. You know, you may get sores, dealing with nausea and vomiting, diarrhea. Another common one is an altered taste. And that really sucks if you have favorite foods and that happens. And of course, constipation. Those things will eventually clear up on their own. Some may need some medications to help along the way. When it comes to long term care, and this is the important part, because you don't see these late effects developing, you don't feel them necessarily until they really hit you. But the key is to be aware of them, especially when it comes to radiation therapy. We call radiation the gift that keeps on giving. In other words, it keeps on cooking. So, in my case, well, rather in long term wise, you have a condition known as fibrosis, which basically is scarring. You may see it as calcification. It makes things very difficult for doctors to work around when there's surgery involved. You may also have to deal with malabsorption. You're not getting the nutrients into your body, into the blood that you need. More importantly, could result in a reduced blood flow. This is important, especially important when it comes to your cardiac and cardiovascular system, which I've already touched on the cardiovascular system. I will get into the cardiac system in one of my upcoming videos very shortly. And then, of course, messing with gut microbes. These are things that you pretty much get diagnosed, by a doctor. Myself, I do have several issues with my intestinal tract. It started out for me, how I became aware of it, having swallowing issues. And this is a common issue among Hodgkin's lymphoma survivors. The radiation, the extreme amount of radiation. And one way to keep perspective on that, I'm talking about those of us who were treated before the 21st century began. So if you were treated as late as 1999, there's a very good chance that you were exposed to a very high level of radiation that they no longer use today. But if that's the case, if things that I'm saying sound familiar to you, you will want to seek out, the aid of a gastroenterologist. And if you need a referral to see them, go through your primary care doctor. Mine started as swallowing my issues. And by that, I mean it got to the point where I couldn't even swallow water. Testing would also reveal that I've got something called a Zenker's diverticulum, which basically is my esophagus is fairly weakened from the radiation. And so there is a flap along the esophagus that actually traps food that eventually turns into bacteria. This comment is going to come in handy in about 4 different terms from now. It can cause a lot of complications. I have something called Barrett's esophagus, which again is another condition that has the potential to turn into esophageal cancer. So I'm being watched for that. I have a hiatal hernia, which doesn't really get a whole lot of attention, and I have reflux GERD, which I control with medication. I control with my sleep position, and I also control with restricting my diet in that I don't eat spicy foods anymore. Sour, any kind of acidy foods like oranges, things like that. I also deal with a lot of polyps. I mentioned, the testing scopes, endoscopy, and colonoscopy. I get those done through my gastroenterologist. Again, removed, I said it in the past video, get the polyps removed. A polyp removed is a cancer prevented. So that's what my hope is with that. I mentioned about the Zenker's diverticulum causing problems. Twice I've had what's called aspiration pneumonia. And basically, what that is that's stuff getting trapped into my lungs, which is assumed from between my reflux backing up and going into my lungs, or actually inhaling the bacteria that gets trapped where this diverticulum is. Almost almost unalived me. I had to watch what I said. Almost unalived me one time as I went septic. I was taken to the hospital at 3 o'clock in the morning on an ambulance stretcher, rolled by my daughters, who, of course, were terrified to see that. Again, I want to stress not everybody deals with these late side effects. And as I always caution, the only way to know if you're dealing with these things is to see the doctors that know how to look out for this stuff. And again, you can find this information on the Children's Oncology group. Again, do not be put off by the term children. It's actually a website, survivorship guideline that is created by many oncologists who put their thoughts together, taking the treatments, radiation, chemo, immunological therapy or immunotherapy, things like that, and all the potential side effects to look up for. So it doesn't necessarily pertain to children's cancer, as radiation is radiation no matter how old you are. And certain chemotherapy drugs, again, doesn't matter if they're used on kids or adults. So the key is to be aware, and that's the goal of this series that I've been doing. I've got a few more to do yet. 2 big ones for me. I've got cardiology coming up. I've got pulmonology coming up. I do want to still talk about my eyes, and then there are a couple physiatry related issues that I want to discuss on here, and that'll complete that part of the series. Try not to be overwhelmed by all this. I know it's a lot. Again, I want to stress, not everybody gets these things, okay? And some get some of them, some get none, some get all of them, some have more than what I have. But the only way to know if you're dealing with this stuff is if you have a doctor looking for it. Doesn't mean you're going to get it, but at least if your doctor finds it, hopefully it can be dealt with sooner before it becomes too serious. Until next time, this is Paul's Heart.